Hello and welcome back to our video series on pharmacology for health professionals. In this video, we'll cover chapter number 6, the prescription, pharmacy, and pharmacist. Learning objectives for this chapter: give the definition of the word prescription, name and describe the types of prescriptions, describe medication orders and other types of orders, describe the difference between the components of a prescription and a medication order, describe the various types of pharmacies and the role that technology plays in pharmacy activities. Describe the role of the pharmacist in filling a prescription. Describe the function and goals of medication therapy management. Discuss the proper storage and disposal of drugs. And lastly, define the keywords and phrases for this chapter. Now, a prescription can be a written or a computerized or electronic or a verbal order that a physician or another qualified healthcare provider gives to a pharmacist, which gives instructions as to how to dispense a drug to a specific patient. A prescription is also a medical legal document, which should convey precise information, and this can be used as a legal document in a court of law. Right, here is the classic symbol that represents prescription. It is a capital R with a line through this part here. So you actually have the R and then X together. That comes from the Latin word recipere, which means to take, because drugs are actually recipes for combining other components to make a drug. Alright, now we'll cover different types of prescriptions. The first type we'll cover is a handwritten prescription. This is written on a single pre-printed form from a prescription pad. These must be written in ink, not pencil, but ink. They must be recorded in the patient's medical record. And this is a traditional way in which prescriptions have been given for centuries. The bad thing about these is handwritten prescriptions can be notoriously difficult to read. And various studies have found that 5% to 16% or even 25% of all handwritten prescriptions are illegible. So if the pharmacist can't decipher what is being ordered, they may dispense the wrong drug or the wrong dosage, or both. So pharmacists often become familiar with a particular physician's handwriting, and they're able to decipher their illegible handwriting. But this is not the best system to use. You can't assume that the pharmacist will decipher what you mean. So of course, if there ever is a doubt, the pharmacist can always call the physician's office to confirm the drug and the dose. And some states, such as Florida, have passed laws that have all handwritten prescriptions must be legible. Now, it is not uncommon for people to steal prescription pads and then write prescriptions on them for drugs so they can abuse them. To prevent theft of prescription pads, medical office personnel know it's important to make sure that these are kept very secure. Any extra prescription pads are locked away in a drawer or a closet. Another way to prevent these from falling into the wrong hands: the physician may only carry one pad with them at all times, and carry that pad with them as they go from exam room to exam room. So there's only one available prescription pad in that office, and it's with that doctor all day. And of course, when it seems the most obvious, never leave a prescription pad on the counter or in an unlocked drawer in the examining room. Some other precautions a physician can take: the physician should sign the prescription only when it is written. You don't want to pre-sign a prescription pad. It's the same concept as you would never pre-sign a check before any other information is filled out. You would sign the check right when you're about to give it to someone. Another form of prescription is computerized or electronic prescriptions. These are typed into a medical office's software system. Then the copy of that prescription is printed out. It's signed by the physician and then given to the patient. And these electronic forms can be faxed directly to the pharmacist, if not given directly to the patient. Now, a good thing about these types of prescriptions, you cut down on trying to decipher illegible handwriting, because everything is typed out on the printout. Another form of a computerized or electronic prescription is one that's generated by a computer also, but it's not signed by the physician. There's a digital electronic signature that is automatically imprinted onto the prescription. So these may also be faxed directly to the pharmacist. Another kind is a verbal prescription. These are given over the phone, and this is not for a controlled substance. The pharmacist can fill the prescription without a printed out prescription and without the physician's signature, as long as they have confirmation directly from the physician, if it's not for a controlled substance. A did you know fact: in 2012, there were 4 billion prescriptions written, compared to 3.3 billion in 2006. On average, 48% of people are taking at least one prescription drug. All right, now we'll talk about medication orders and other types of orders. So we'll cover medication orders first. These are a written record of a physician's orders. These are handwritten on large pre-printed order sheets known as the physician's order sheet, and these are found in the front of the patient's medical record. Now, for clinics and hospitals that use electronic records, these will be typed into the computer on a designated screen, and the screen serves as the physician's order sheet. Verbal orders or telephone orders. This is when a patient has already been admitted to the hospital. So a physician may give a verbal order over the phone to a licensed nurse, for example, and then the nurse would write down the order on the physician's order sheet. This is indicated by the letters VO for verbal order. And then the nurse will sign his or her name, and the physician must personally sign the order within a specific amount of time. See, a stat order. This is when a physician wants a drug to be dispensed and administered immediately. There's also a standing order. This is a group of specific orders, and these will be pre-printed on a facility's physician's order sheet. Now, standing orders often pertain to a protocol of treatment for a specific disease or a procedure. In addition, a physician may also write more specific medication orders to address a particular patient's medical needs. An automatic stop order. This originates from the hospital pharmacy and not the physician, and these are used for certain types of drugs, controlled substances, for example, and these are only valid for a certain number of days. And this issue of an automatic stop order is determined by the hospital's pharmacy committee policy. When this order is issued, the pharmacy will automatically stop sending the drug to the patient, and then an entirely new order must be written by the physician. And all drugs carry an automatic stop order. Now, these are issued when a patient has a change in their situation, if they're transferred to another nursing unit, or if they are discharged to another healthcare facility, or if they're discharged to go home. Okay, a quick focus on healthcare. In a hospital or other healthcare facility, the physician's office address and phone number are not needed on the physician's order sheet because the physician is already a member of that facility's staff. So prior to joining the medical staff, each physician must provide their name, their office address, their home address, corresponding phone numbers, social security number, state medical license number, any federal or state DEA number, educational background, and board certifications in a written application that is kept on file in that facility's credentialing department. No physician is permitted to write orders, including medical orders, unless he or she is already an approved member of that facility's staff. All right, now we'll talk about various components of prescriptions and medication orders. First, the identifying information about the physician. This will be found on the prescription form. This will be pre-printed at the top to best identify the prescriber. So the doctor's name, the office address, and then the office phone number. In case there are any questions or issues with the prescription, they know where to call and to who to ask for. This is a fairly standard prescription form. Doctor's name here on top, office address, office phone. These will always be pre-printed at the top of a prescription form. When it comes to a physician's order sheet, this will require a physician's signature, and all other information is on file with the hospital. Okay, next we have identifying information about the patient who will be receiving the prescription. This is used to positively identify the patient. It will include their first and last name, and also their address. On a physician's order sheet, the patient information is already on the order sheet. If it is a computerized record, it will be pre-programmed to already be there. If it is a paper record, the hospital card is created and used to imprint an order sheet. See, the patient's age and weight. This information isn't used on a prescription form, but it can be useful, especially when it comes to a child. So the age of a child will be needed on a prescription form if you are prescribing a Schedule II drug. And when it comes to the patient's weight, the dose may have to be adjusted either high or low, depending on the weight of that patient. When it comes to the physician's order sheet, if the patient's age and weight is already entered into the demographics face sheet, so these will not be included on a medication order. When it comes to the date on a prescription form, the physician will write out the full date. Now, you can't just put August 1st. You can put August 1st, 2016, for example. Now, a prescription is good for various lengths of time, depending on what type of drug is being prescribed. A prescription is good for 1 year in general. It's good for 6 months if it's for a Schedule III through a Schedule V drug. And it's only good for 7 days for a Schedule II drug. When it comes to the physician's order sheet, the full date and time will be next to the medication order. And then orders that are in the hospital are time sensitive. These must be filled and administered in a timely manner. The symbol RX, this has been written since ancient times when it comes to prescriptions. The symbol actually stands for the word recipair, which means to take. because at one time drugs were actually seen as recipes. You would list several ingredients and they'd be crushed and mixed by the pharmacist to create that drug before they were dispensed to a patient. So most prescription forms come with a large RX symbol, usually to the left of the area where the prescription would be handwritten. So going back to this generic prescription form that would be handwritten, identifying information about the doctor appear, the pre-printed information, area that you would handwrite the drug order here, and to the left of that, the RX symbol. When it comes to the physician's order sheet, the symbol is not pre-printed, and this order sheet is relatively large, and it's also used to order other types of treatments in addition to just drugs. When it comes to the drug name, the same rules are applicable for both the prescription form and the physician's order sheet. You may write either the drug's generic name or the trade name. The chemical name is not used, and abbreviations of drugs are avoided because they may be interpreted incorrectly. When it comes to the drug strength, the same rules apply for both the prescription form and the order sheet. The number appears right after the drug, indicating the strength, and that would be followed by a unit of measurement. And the drug strength that is ordered must correspond to a strength that the drug is manufactured. So for example, if a certain drug is manufactured in 25 milligram and 50 milligram tablets, the physician couldn't order that drug in 80 milligram tablets, because that's not how it's made. It comes in 25 or 50 milligrams. But if the tablet is scored, the physician can order exactly 1/2 an amount of one tablet. So that's one of the reasons why tablets are scored, to be broken in either halves or into thirds. So when it comes to the drug form, the same rules apply for the prescription form and the order sheet. The specific form must be included. When it comes to the quantity to be dispensed, on the prescription form, the pound symbol is read as number, and this indicates to the pharmacist the number of capsules or tablets, etc. to be dispensed. And sometimes this will preface the number with the word dispense. When it comes to the physician's order sheet, you do not need to indicate the total number of drugs to be dispensed. The medication order continues while the patient is in the hospital, and the exception to this would be controlled substances. So only the amount needed for one day is sent to the unit. Directions for use. On a prescription form, the abbreviation SIG indicates directions. So the pharmacist will type on the label, translating any Latin abbreviations, which would include the amount of the dose, the route of administration, and the frequency of the dose. So when it comes to the physician's order sheet, the abbreviation SIG is not included, and the pharmacist doesn't translate the Latin abbreviations, because at that point people should know what the abbreviations stand for. It's not necessary to translate. And then of course the signature on the prescription form will be found at the bottom of the form. It'll be signed on a pre-printed line, followed with the letters MD, your medical doctor. And a physician must sign their name on that line for the prescription to be valid. And the same principle as writing a check. If you fill out a check but don't sign it, it's not worth anything. When it comes to the physician's order sheet, the physician will sign their name with the letters MD following. This will be found directly below the last medication order. And this prevents insertion of an order at a later time. When it comes to the number of refills, on the prescription form, this indicates how many times the patient is permitted to refill that particular prescription at that frequency, at that dosage. And you'll find a pre-printed area that says refills, followed by numbers, 0, 1, 2, 3, and so on. Sometimes you'll see the letters NR for no refill. And these are only good for 1 year for most drugs, but there are no refills available for Schedule II drugs. When it comes to the physician's order sheet, there's no indication of refills, so the pharmacy will continue to send as long as the patient is hospitalized or until the physician orders a drug to be discontinued. When it comes to substituting a trade name drug for a generic drug, on a prescription form, some states actually mandate that the pharmacist fill prescriptions with a generic drug, and if the physician wants a trade name, they must specifically indicate so. So you may see terms such as DAW, dispense as written, or no substitution on a prescription form. On the order sheet, the hospital has all formulary for all stocked drugs, and the pharmacist will dispense generic equivalents unless the physician specifically requests a drug name for that drug. Another component of a prescription and medication orders is a place for the DEA number. On a prescription form, if a drug has potential for abuse, such as a controlled substance, the doctor's assigned federal DEA number must be on the order in order for the prescription to be valid, and this DEA number consists of 9 characters. On the order sheet, the DEA number does not need to be provided when a physician is in the hospital or another healthcare facility, because the healthcare facility would already have that information. That information will be kept on file already by that facility's credentialing department. All right, so going back again to our generic prescription form that will be handwritten, the pre-printed identifying information of the doctor up here, a place for the patient's name, their age, the full date will be written out, a patient's address, the symbol RX, the handwritten directions will be here, the frequency of the medication, the strength of the medication, any number of refills here. If there's no substitute allowed, that will be indicated here. Doctor's signature, followed by the letters MD, and if needed, a place for the DEA number here at the bottom. Now when it comes to writing prescriptions for a Schedule II drug, these must be written on special prescription forms. This is known as an official prescription form, and is only printed by a certain number of printing companies designated by that state. Now the official prescription forms contain various security features, such as a control number, a thermochromatic ink, and an imprinted seal that are designed to prevent any types of alterations or any kinds of forgeries. Now these are used as a precaution to avoid the unauthorized use of drugs that have a high potential for drug abuse and addiction. In addition to these official prescription forms may include the background repetition of the word void that becomes visible if someone tries to photocopy this form or tries to fax the form. But even with these precautions, there are thousands of prescriptions for Schedule II drugs that are forged each year, and the pharmacist may contact a physician's office to verify that a Schedule II drug has been prescribed. Now occasionally, you may have some physicians or dentists or pharmacists prescribe or dispense Schedule II drugs to patients who have a drug habit in exchange for money. Now these individuals can be investigated by their state licensing board and with the DEA, and denied renewal of the federal DEA number that is needed to prescribe such scheduled drugs. Now there are some states, such as New York for example, that now require that an official prescription form be used to prescribe all drugs, not just Schedule II drugs, but all kinds of prescriptions. All right, now we'll talk briefly about a drug controversy. Prescriptions for generic drugs only accounted for 13% of all new prescriptions that were filled in 1995, but accounted for 45% of all new prescriptions filled in 2006. So the use of generics rather than the trade name drug can result in considerable savings to consumers. But for certain critical drugs, such as Lanoxin for congestive heart failure and Dilantin for seizures, and some anticoagulant drugs, many physicians prefer to rely on the proven therapeutic action of the trade name drugs. All right, now we'll talk about the pharmacy. After the prescription has been submitted, it then becomes property of the pharmacy. The pharmacy is responsible for keeping it on file, and these may be kept for several years, and the length of time is specified by state law. When it comes to an inpatient or hospital pharmacy, these will only dispense to patients who are admitted to the hospital. Another kind of pharmacy you would find are called satellite pharmacies, and this is where you would have a pharmacy that would dispense drugs for that particular area of the hospital, as opposed to having one central pharmacy for a large hospital complex, for example. So you may have a pharmacy that only issues drugs for the cardiovascular wing or the critical care unit. So a satellite pharmacy is just one that will focus on one ward of a hospital, one region of a hospital. Also in hospital, you'll find medication carts. These are for transporting patients' drugs, and this is wheeled from the room to room to room to save time. So when using these, the nurse administers, then charts medication on the patient's medication administration record, the MAR. And if this form is used in electronic form, it's called the EMAR, electronic MAR. The other kind of pharmacy that you will find is an outpatient pharmacy, also called an ambulatory pharmacy. Now these can be primary care based or disease specific, depending on what the clinic may care for. Now one good advantage for an outpatient pharmacy is at the same site that they receive their medical treatment, so they don't have to make another trip to a regular pharmacy to get their medication. Some examples of an outpatient pharmacy would include clinics that specify in certain diseases or certain conditions, community pharmacies. These are pharmacies that will serve one specific area, one specific community. You can also have a compounding pharmacy. In this kind of pharmacy, drugs are prepared on a personalized basis. The preparation, mixing, and packaging drugs under sterile conditions. So if a patient is not able to take a commercially available drug that is in shortage or maybe discontinued, a compounding pharmacy may be able to make that for that patient specifically. Some other ways you may want to specialize a medication would be the flavor of the medication, especially if you're giving it to a child, reformulating it where a non-essential ingredient may be taken out, like gluten or a dye that the patient may be allergic to, changing the form of the medication in case the patient has difficulty swallowing tablets or capsules. Another example of a pharmacy you could have is a telepharmacy. These are mostly used for communities that are in remote locations where they may not have direct contact with a pharmacist. The next term we'll talk about, pharmacoinformatics, which is pharmacy informatics. It's a computerized database to store drug information and to automate its retrieval when needed. Barcode technology is often used to help track all this information. Pill imaging technology, so pills can quickly be identified. And these methods are also used in a corporate pharmacy chain, so we have multiple stores in various parts of the country. So the whole point of pharmacoinformatics is they use technology for medication management for more efficient and beneficial patient care. Another type of pharmacy are online pharmacies. Now these provide convenient services to patients. You can order prescriptions over the internet. Then once those are completed, the drugs are mailed to the patient at their home. Now legitimate pharmacies have a seal on the homepage of their website that will say Verified Internet Pharmacy Provider Site. Now patients can also mail in their actual prescriptions to these online pharmacies. The internet pharmacy can call the doctor to verify that it is a valid prescription. And some internet pharmacies do not require a prescription form, or they do not check with the patient's physician. Both of these are not safe at all. Now some online pharmacies advertise that they provide prescription drugs without the prescription. What they have you do instead is the patient fills out a medical questionnaire online. And again, without being able to confirm who the patient is or even if the information that they're supplying is valid, this can be very dangerous. Another way that online pharmacies could work is having an online pharmacy company doctor. The doctor doesn't examine the patient, but they write the prescription that the patient wants. This brings us to ethical concern. Now, the internet is an easy source of drugs for an addict. Easy for anyone to forge a prescription for a prescription drug or even a scheduled drug. And what's common is these are sent to several internet pharmacies at the same time in order to obtain multiple bottles of the drug, which would be somewhat easy to do if there's no prescription order that's needed from a legitimate doctor, if there's no exam by a doctor, if there's no verification of the prescription. It'd be very easy to do this at various online pharmacies all at once. Now, some online pharmacies obtain their drugs from foreign countries, and when this happens, the quality and the purity of the drug may be compromised. All right, now we'll talk about the pharmacist. This is a healthcare professional with an advanced degree in pharmacy, and that degree is the PharmD. They will be very knowledgeable about all aspects of drugs. They usually have support staff that works with them, the pharmacy technician, and these may complete a pharmacist's task, and they also will check for accuracy. When it comes to a hospital pharmacy and their responsibilities, they receive the physician's order, they verify the drug and the dose, they check the patient's medical record for any possible allergies or any possible interactions, they check the drug formulary for stock, they dispense the drug, and then they consult with physicians on site. For outpatient pharmacies and their responsibilities, verify the drug and dose that's prescribed, check the patient medical record for possible allergies or interactions, check the drug formulary for stock and that the drug is approved by that patient's insurance plan, of course fill the prescription, then it will create a unique prescription number. Some other responsibilities of outpatient pharmacies, they will place warning labels if applicable. They will use child-proof caps on bottles if necessary. They will attach pre-printed patient information sheet, and also they will dispense the drug. In this image we have an example of a child-proof cap. These require a little bit more strength than a child would have to open, where you have to push the cap down as you turn it. The other responsibilities of the pharmacist, offer advice about diseases and drugs, provide personalized assistance to customers. This may include consultation about disease management or weight management or stopping smoking. Medication therapy management, or MTM, will facilitate these communications. These are all patient-centered. And what the MTM is a comprehensive review of all the medications that patient takes. And sometimes this will be reviewed annually or as needed, depending on that patient's need. All right, now we'll talk about the proper storing and disposing of drugs. Now, the heat and moisture that's common in bathroom medicine cabinets can break down drugs. So the best place to store drug is in a cool environment in a locked storage box, especially if you have children in the home. Children may think that the pills that you are taking are candy because they have bright colors and weird shapes. Now, it is important to dispose of drugs safely when they are no longer being used. Do not flush them down the toilet. It's not a proper way to dispose of them. It may be convenient, but it is not a proper way. Most pharmacies will accept and dispose of drugs that are not being used. They will incinerate them. Some police departments have programs to allow them to dispose of narcotic or scheduled drugs. If you absolutely have to do it yourself, the way you would do it is crush or dissolve your drugs, mixed with a small amount of water and coffee grounds, kitty litter, or anything else that is inedible. And you put that big mixture into a sealed bag and then put that into the trash. And the whole point of this is to make sure that if another person were to stumble upon it or an animal, they wouldn't want to eat it because it's mixed with coffee grounds, kitty litter, anything else that is inedible. So this would not be that appealing to try to use. Okay, that brings us to the end of this video on chapter number 6. We will continue our video series on pharmacology with our next video on chapter number 7, urinary drugs.